Hello, parents. I got to tell you, making decisions can be definitely tough for your kids, especially when it comes to the healthcare. Hey, I am Dr. Randy Wirtz, inThrive Chiropractic, and today we are going to talk about the 5 concerns parents have when they start considering chiropractic as a way to help their child become healthier too. So, number 1 is this: is it safe? Definitely the number 1 question parents will have, especially moms, to show it's safe. Well, yes, absolutely it is, because care is designed for the effectiveness, obviously, but also the comfort of the patient and the size of the patient as well. Now, with that being in mind, parents like to know what to expect. So we want to explain things as we go so you understand, hey, the process and what to expect. Sometimes kids, they just don't like being touched and they cry because this is somebody new that's a new experience for them, but we have to walk through parents through that and let them know what to expect as well. Number 2, how is care performed? Well, care is performed to the size of the patient, the comfort of the patient, the comfort of the parent as well. So you understand this is what we're doing. And obviously we have to be effective as well. So sometimes we have to problem solve a little bit and think of some creative ways to adjust the child to make it not only safe, comfortable for them, to make sure that they want to come back, obviously, but also effective as well. That leads to number 3. Is it effective? Hey, we're looking at the nervous system. The nervous system controls everything, and it's a natural solution or a drugless solution to problems your children are having, like colic, meltdowns, emotional dysregulation, ADHD, autism, immune system compromise, digestive issues, allergies, all those types of things. So parents want to say, hey, maybe you tried a lot of those other ways, a lot of the medications, the drugs or surgery. Let's try something different. Or it aligns with your values and says, I want to try this way first. I want to try drugless first and a natural solution, but a different way to look at things as well than the traditional medical approach. Number 4, what if there's an underlying condition? Dr. Randy, I've seen this before and I've had to address this before too. My child has a genetic condition. Can you help me? Absolutely. Because we're working with the nervous system. Now I'm saying we're not going to cure those genetic disorders or some other disorders that may have happened. But the problem is the nervous system isn't working correctly. So we're going to examine the nervous system to get that firing so the body functions so much better than they have before. And you're going to realize that the quality of life becomes so much better with these kiddos. And sometimes we have to, again, adjust the adjustments, the care provided to what the condition is with the child. And lastly, the cost. A lot of times parents will say, does my insurance cover this? Well, I got to tell you, they only cover musculoskeletal conditions, and I am definitely neurologically focused. So hate to be the bearer of the bad news, but generally speaking, no, they don't, unless there is some component of musculoskeletal, because we're looking at the nervous system involved as well. Now, let's think of the other costs though too. What's the cost of going to this specialist, this person, this person, this person? So there's time. And we don't compartmentalize symptoms in this office. We look at those symptoms to trace back to the source of the cause. And we always say, hey, this is the nervous system. And oftentimes, very often, we find that those systems lead to clues that show up on our scans and our physical exams as to why they're having those problems to begin with. There's a very strong correlation and causation to those as well. We do the care plan and say, let's stick with this care plan. Let's modify that care plan as needed. And then we often see many, many kids, many adults to get much better and have a much better quality of life and getting over their conditions. So, hey, if you were on the fence about maybe trying chiropractic, you know that it works, you just don't understand some of the questions or some concerns that you have, I hope this addressed some issues for you. And maybe it's the next step for you to get your child healthier. By all means, we'd like to be the next step in line for you to help your child, not only your child, but your family get healthier as well. Until then, I'm Dr. Randy Wirtz, inThrive Chiropractic. Have a blessed day.